Why I help moms breastfeed is because it's what makes us feminine. It's the most feminine thing that we can do, because our bodies are made to grow babies and to give birth and to breastfeed. And this is why Creator made us women. And when moms and babies fall in love during breastfeeding, it can change a mom's perspective about life. She can feel important. She can feel that she has value. I would suggest moms breastfeed exclusively for 6 months, because that's about the only time in the baby's life that you're going to be the #1 person in their life. You're going to be there for the nutritional benefit. You're going to be there for the immunological benefit. You're going to be there for the mental health benefit, for the comfort and the love. When we breastfeed our babies, the babies know where their center is. They know where their soft and their safe spot is. And we can't tell moms to stop that. So for 6 months, that mom is the #1 person in that baby's life. Creator said women grow the babies. Creator said women are in charge of the food, and Creator gave women the breast. That's why we have breasts, is to feed our young. Now, our milk that we make is tailor-made to what that baby needs. So the milk's going to be different on day 1, or the colostrum is going to be different day 1 than it is on day 3 when the mature milk starts coming in. And that's different than the milk that's going to be there on day 10. And it's going to be different than in month 4 when they start putting things in their mouths and their immune system needs an extra boost. So nursing to 2 years, it does provide, I guess the standard answer would be immunological benefits and nutritional benefits. And it's more than just the love. The immune benefits are really important, because when they're at 2, a lot of kids are in daycare, or they're getting out to more play groups, so they're getting exposed to a lot more germs. So babies need that nutritional boost that they will never get from formula. But it's worth it. It's worth every moment that you're lacking sleep. It's worth every moment when that baby's looking at in your eyes and the milk's dripping out of their mouths. It takes a lot of dedication, but it's worth it. Moms and babies need to have that attachment. They need to have that bond. They need to have that love with each other. When babies are born, like the first hour or longer, they should be on that mom's chest. Babies should not be moved at all until that baby has their first breastfeed. Why? That's what they're made to do. Babies are given this gift from the Creator. So when they're born, they know how to get to their mom's breast and to breastfeed, and nobody has to do anything except make sure that baby's warm. It's really important to get prenatal information about breastfeeding, so you know what struggles that may happen in the first couple of days, so you're prepared for it. And what's going to be happening at the first week, or going through a growth spurt. And if you don't know what growth spurt is, look in this website, because there's lots of information here for Indigenous families that will explain to you what a growth spurt is, so you know what your baby's going through is normal. That yes, you do have enough milk, the baby's just giving it a kick and upping your milk supply. It's really important to get breastfeeding information, so you can see that there's different types of latches. There's not just one way to latch and position a baby. It's all informed choice. So you latch the baby one way. If that doesn't work, you latch the baby another way and see if that works better. So be sure on this website to check out what to expect the first few days, how the breast makes milk, and what to expect the first week of breastfeeding, and how the baby latches, suckles, and drinks, because knowing the difference between a suckle and a drink is very important. Hormones are very important when it comes to breastfeeding. So the breasts are an important part of the breastfeeding, and the brain is actually a very important part of the breastfeeding, because it's in the brain where the hormones are made. It's also in the brain where we feel stress. So first, moms, before you put the baby on, take a nice deep breath. This is a model kind of how our breasts, I brought a breast anatomy. When the baby starts suckling on the breast, it's going to tell your brain to release oxytocin. Oxytocin is the love hormone. It's the hormone that got you through labor and helped you to birth your baby. But when the oxytocin hits these little things here on the breast, these are called alveoli. It's going to squeeze the alveoli. And the alveoli are attached to these straws, but say they're tubes. And then as the baby's suckling, the milk's going to go from the alveoli through the straws, tubes, into the baby's mouth. which is very cool. Then it goes to your brain, it goes to your alveoli, it goes out, and then it's a cycle. So the other hormone that's very important in breastfeeding is called prolactin. Prolactin is the hormone that makes your milk. And so it makes the milk and it puts it in the alveoli. Prolactin, especially in the first 6 weeks, is highest at night. So it is very important that a mom breastfeed throughout the night. I'm not saying every hour, but every 2 to 3 hours throughout the night, because that's when the prolactin level is highest. When you work with high prolactin levels, that usually helps you to have a really good milk supply for that upcoming day. If you go 2 or 3 nights early on with the baby not nursing through the night, or maybe nursing once through the night, depending on the mom and baby, but more often than not, your milk supply is going to come down. I know some women thought that they could exclusively pump during the day and have dad do all the feeding at night so she could sleep through the night, but that was detrimental to her milk supply. When baby is drinking at the breast, so this is a drink at the breast. That is where baby's getting their milk, is when they're drinking at the breast. So you should go like this, so baby's drinking at the breast. He's going to be taking the milk from the breast, sucking it down into her little tummy. Now, if there's a lot of milk left in this breast, it's going to tell your brain, we've got a lot of milk, don't worry about it. Because sometimes moms switch sides too quickly, leaving a lot of milk in the first side. If there's constantly a lot of milk left in a breast, then the milk supply is going to go down. So at every feed, what you need to do when you breastfeed is to nurse that baby, good latch, make sure the baby's drinking really well on the breast. And then milk supply goes up and down. It's an ebb and flow. So baby will go slow, and then baby will go quicker. Then baby will go slow, and then baby will go quicker. When the baby's constantly quicker, even with breast compressions, and baby still shows signs of hunger, it's a great reason then to switch sides. So try not to switch sides before it looks like the baby's no longer getting milk out of that breast. If you switch sides too quickly, it can also lead to a lot of gas in the baby and bright yellow poops and maybe a colicky baby, and you just don't want that. With the supply and demand, what that means is whatever the baby wants to drink each feed, that's how much milk you're supposed to be making. But the most important part is watching what your baby's doing at the breast. If the baby shows signs of hunger, offer the other one. Some moms offer both sides at each feed. Sometimes the babies take it, sometimes they don't. Some moms only nurse on the one side and baby's completely satisfied. Sometimes babies only want little top-ups in between the big feeds. So work with your baby, see what your baby wants. And it could vary day to day. Sometimes babies will have one breast per feed, but when a growth spurt comes, they're probably going to end up taking both. And some babies may always want both. Baby-led latching I love best because baby is using his instincts to find, or her instincts to find mom's breast and to nurse all by themselves. Make sure the baby's nice and warm. So one of the beautiful things about skin-to-skin contact is then sometimes babies need hat and socks, sometimes they don't. But skin-to-skin contact, mom is naked from the waist up, baby's just in a diaper. Cover mom and baby with a blanket. They're usually the same temperature, but moms and babies are symbiotic with each other, and they keep each other at a great temperature. So for baby-led breastfeeding, moms just get lazy, lay back, relax. You've done a lot, especially the first hour after you have the baby. The last thing you want to do is get this complicated. So just be here, put the baby in a frog position between your breasts. Just make sure the baby doesn't fall. That's all you need to do. The baby will feed when he's ready, or she is ready to feed. So just be patient. In time, the baby's gonna start feeling for the breasts. Baby's gonna start head bobbing. Baby will pick a side, and then we'll start licking it, and they'll head bob, trying to find where that nipple is, and then and the baby will nurse all by themselves. And everybody's always amazed, but that's how babies were always breastfeeding from the beginning of time. I will say there is no one right way, no one wrong way to latch a baby. If it hurts, that's the wrong way. I have seen some babies latch and it looks completely wrong to me, but the baby's gulping the milk and the mom's in absolutely no pain, so I don't do anything to help. I like teaching, if you're not doing the baby-led breastfeeding, I like having the baby across the forearm and you're stabilizing the head. You're not holding the head. Leave your breasts where they are. Some women do have pendulous breasts, well, they will need to be held. Some women have these perky breasts and they won't have to do anything. So when you're positioning the baby near the breast, put the nipple right here, right at the top lip pointing to the nose. Some people like moving it back and forth. I prefer to leave it. Whatever works for you and your baby is perfect. So put the baby there, right at the nipple pointing to the nose, and the baby, instinctively will start going like this, will bob, and when you see the baby put their head back, it automatically opens up the jaw, and you want to work with that. So baby, here's baby here, like that, and then you move between the shoulder blades, and it helps to open up that jaw, and the nipple should be like that in the baby's mouth. It should be up at the roof of the mouth towards the back. Again, we want the baby, you want your nipple here. The baby will feel for it himself. And then when he's getting ready to go, you just push him gently, nice and tight between the shoulder blades. It tilts the head back. So that way, the baby is on the breastfeeding. If you're putting the baby in nipple first, the baby's gonna nipple feed, and then breastfeed, and that's where a lot of the breastfeeding pain comes in. We don't want moms to have pain. So if your baby goes on with a nice big mouth, it covers that up, and then it should be good to go. Now, if people want to do the football hold, so that's on the side. The same thing is that you want the nipple to the top lip and bring the baby in by the shoulder blades. Let the head tilt back a little bit, just to ensure that nice big open mouth. No scooping the baby onto the breast, because that closes the mouth, and then babies will nipple feed and then get on the breast, and that causes a lot of pain. So what babies need to have is as big a mouth as possible, and as much as the areola as possible in the mouth. If the baby's mouth is closed, all they're going to do is suck on the nipple, and that's going to cause immense pain. We want the baby to suck on the areola because it's breastfeeding, so then the nipple is protected at the back of the mouth, and that shouldn't be causing any pain. As humans, if we're going to drink out of a water bottle after a marathon or something, we're going to tilt our head back too, so the water goes down quicker. That's what we're trying to help the baby to do by tilting that head back, is to facilitate the big open mouth, and so the baby has quick access to drink. The other common position to nurse a baby would be to have the baby along the same arm that the breast is. One of the big mistakes I see when people choose this particular position is that they put the baby's head in the elbow because it's more stable, but then that causes the head to go down onto the breast. So that leaves a very closed mouth, which would lead to nipple feeding, which would lead to a lot of pain. And the throat is more closed. So if you're choosing to use this position, no problem. Instead of having baby's head in the elbow, just move baby down. Move baby down the arm. So until the nipple is at the top lip, and the baby's head is slightly tilted back, and then the baby will have better access to the breast and should hopefully nurse without pain. I do a lot of visits where they say, "Oh, it's hurting, can you help me?" And all I do is, okay, just move the baby down your arm, and I move keep their shoulders still, because they usually go like that. So I keep their shoulders still, and then they go, "Oh, that feels so much better." And it's like 1/2 inch to 1 inch down the arm, that's all it is. It's important to know when the baby's getting enough and that the baby's breastfeeding well. Why? Number one rule is to feed your baby. So ways you can tell the baby's breastfeeding well and getting enough: when they are on the breast, they are drinking substantially throughout the feed. So it is normal. Breast milk goes fast and slow and fast and slow. So babies will probably be drinking, and then they'll get into a little the quick suckling. Then they'll go back to drinking again. You add some compression in to help drain the breast more, and helps to get the higher fat milk out. And that's one way you can tell that the baby's breastfeeding well. In the first few days, there's a big fear of moms from moms and dads that they're starving their baby. Babies are born with a stomach the size of a teaspoon, maybe a teaspoon and a half. If baby's latched well and drinking well at the breast, they're going to get full. Baby's stomach does not increase in size until milk volume increases. Like a balloon doesn't get bigger until there's air going into a balloon. A baby's stomach can't get any bigger until there's an increase in volume in the breast milk. So you want to look for that baby drinking at the breast. The other thing the baby needs to be nursing throughout the day and night, every 2 to 3 hours. The other major part is to look at the baby's diaper. I see poops a lot in my job. You can tell a baby is feeding well by looking at the diapers. A baby should be pooping 2 to 3 times from day 1. There is the exceptional baby that may poop just once, but usually they have a lot of that meconium, that dark poop, a lot at the birth. But babies should be pooping 2 to 3 times per 24-hour period. And hopefully by the end of day 2, that milk is starting to change from that black tar color and feel, and it's very sticky, to a darker green. And then it starts to lighten up. Look at how the baby's breastfeeding. Try to drain the breast at each feed before you switch sides. Offer the second side if you want to at each feed. And look at the diapers. Babies will pee generally 1 time per day of life until the milk comes in. So on day 1, they'll just pee once, because if they're only drinking a teaspoon at a time, there's not much to pee out. When the milk comes in, it's still usually another 12 to 18 hours before they have the sopping wet diapers. And that's obviously going to be a great sign that the baby's feeding well, but on day 1 and day 2, don't expect that at all. Other ways that you can tell that the baby's breastfeeding well is to watch their weight. It's normal for all babies to lose some weight at birth, but over time they will be gaining weight. Watch the baby's energy as well. If the baby is able to wake up on its own for feeds and they are alert when they are at the breast, if that baby is very difficult to wake up even at the 3 or 4 hour period, and they don't stay awake at the breast, you're probably going to want to look for some help. This might mean that you're not getting enough. It's really important to get help. We're very lucky in Ontario that we have provincial ways to get help with breastfeeding. This website is great to troubleshoot. There's also the OntarioBreastfeeds.ca that will help to locate breastfeeding help in your area. There is the Latch League, if you LALECHE, then League. You can find them online. They have wonderful information sheets, but they also have monthly meetings. Learning and getting support from somebody who might be going through the same issues that you're going through can be a great help. And there are also specialists when it comes to breastfeeding. They're called lactation consultants. You can look them up online as well. Just put lactation consultants in Canada and you'll get a list of lactation consultants that hopefully will be in your area. It is really important to get help when you're breastfeeding for a lot of reasons. If you're having pain is not normal with breastfeeding. It really isn't, even though that's what the media says, that you're going to be going through periods of pain. If you're having pain, please ask for help. They're out there. Some women are on call 24 hours a day just to help moms breastfeed. Other reasons to get help, if you're noticing cracked nipples or you're getting blistered nipples, babies isn't peeing enough wet diapers, or he's not pooping. If you feel like you're struggling too much and you don't know if you're doing anything right, and sometimes you're just looking for that cheerleader to help you through it, it's another great reason to look and to get breastfeeding help, because you shouldn't feel alone in what you're doing.